All right, this is the Anticoxa Global Reset strategy as part of the non-surgical hip replacement program. You're going to start in a quadruped position. From here, you're going to step the hands forward till the legs are at a 45-degree angle. You're going to engage the core and you're going to keep the pelvis stable. From here, you're going to bring the knee out in an arc towards the hand. Bringing the knee as high as you can, and then bringing the knee back to neutral. You'll do that about 10 to 12 more times. Then you'll place the block just to the inside of the wrist. You'll bring the knee up, touch the knee to the block, and then press the knee into the block. Hold that for about 10 to 20 seconds, and then release. Do that about 2 to 3 times. So this is the first strategy, the first exercise as part of the Anticoxa. Remember, this is not about strengthening, this is a global reset strategy. So we're reprogramming the motor control pattern to affect the hip and make the hip move in the way that we want to see the hip move based on our assessment. Thanks for watching.